Hey everyone, so this is August 21st, 2021. Just giving an update for today's events medically. I went to the hospital again today. I'm not going to say which one, but I went to the hospital again to have an MRI done. This is an extension off the video where I said it was a blessing that I didn't need radiation as a prerequisite to get the MRI, which most hospitals usually require radiation from an X-ray or a CT scan, specifically an X-ray, just as a formality before approving an MRI. So this is an extension off of that video. And so I had my MRI today on both my knees, and then Monday I have to do a MRI on my right rotator cuff. My left rotator cuff is starting to, I think, feel the pain. I'm starting to feel pain from the damage of the erosion of the cartilage and everything in my left too, but it's not as bad as the right rotator cuff. The right rotator cuff is pretty bad. So before I do any lifting, even light lifting, to get back to eventually training in the gym again, I want to know what's going on, if I have any micro tears or anything like that, because that can really be a bad situation if you work out and you have a micro tear and then you actually rip it, because those micro tears rip because you're trying to do something on a shoulder and you don't know you already have a small rip or a small tear. Then it gets worse. So I just want to rule that out before I continue to do my physical therapy and on my rehab. But today, it went well. It was really quick. Each knee was about 20 to 30 minutes. And you guys, if you've paid attention to my channel or you follow me, you've already saw the photos of the damage of that medication and what it did to my knees. So I already got photos on here documenting that and chronicling that. So my knees still look pretty bad. So they should be able to tell me definitively what's going on with those holes and those deformities. And I'm gonna try to have them sit down and go over it with me and point to the images and tell me what's what, because doctors don't do that anymore. So it's so informal, it's so impersonal nowadays. I remember years ago, 20, 30 years ago, they sat down with you and they always went over the X-ray images or CT images. I mean, it was just standard practice. So now you kind of have to make appointments and kind of ask for, for one-on-one illustrations, so to speak, or explanations in person, and to recognize what's going on with your images, because we don't know, we can't interpret those images. So anyway, that's where I am now. Thank God I had the 2 MRIs on my knees, and so they should be able to see all the damage and explain what it is and whether I can still work out on my knees the way I really want to build them back up. If it's safe to work out again, I should know after shortly. I don't know when, but shortly. I get the results Tuesday, but when I can make an appointment with a doctor to explain where I'm at, that's another story. But at least we're there. At least I'm there where we're gonna know how much damage there is eventually and where I can go from here as far as my physical therapy and possible continuation of my physical training going forward. And so I'm just waiting for Monday for my shoulder MRI, and that's where I am now. This doctor did a lot of damage to me. I'm always gonna put his name out there. Every video, his name is Dr. Charles S. Modeling. I hope nobody ever has to go through the tragedy that I'm going through now. No type of trauma to the body from a doctor who's either negligent or deliberately just wants to guess or make money from a pharmaceutical company. I just hope that nobody ever has to go through what I'm going through. And again, the start of that is by making people aware and being an advocate for patients and patients who've been injured, or families that have loved ones who have been injured or killed. I'm gonna, for the rest of my life, I'm gonna not full time, maybe full time one day, but at least right now, part time, I'm going to devote the rest of my life to patient advocacy and get the word out. If any of you guys know some names that needs to be put out there, especially if it's like somebody in Cleveland, that I can investigate and see what's going on. And it turns out there's some foul play, I'll put that doctor's name out there. I mean, so I'm trying to make this channel more than just me. I want everybody to be helped from this channel based on my story and based on my trauma and based on what Dr. Marlin did to me. So I don't want people just to know, don't go to him and put your life or your safety in jeopardy. But I also want to look out and have other doctors on the radar. Because I don't want to go to another doctor like Marlin. And I want other people to hear a list of names they shouldn't that they should stand clear of. Like I said, it could be a local Cleveland area or it can be another city. I don't care. But I'm focusing right now, just so you guys know, I'm focusing on my locale because that's where I am. And so I have to start with, just kind of locally before I branch out to other cities. I'd rather start out with people in the local Cleveland area and be an advocate for my area first and then possibly branch out. But anybody in the local area, greater Cleveland, suburbs, Akron, Canyon, anywhere around the Cleveland area, let me know. If you know some people that's into some foul play, and I'll look into it. And if it's legit, I'll put them out there. Just like I'm doing Dr. Modlin. Dr. Charles S. Modlin did this damage to my body. So anyway, everybody, that's where I'm at now. Thank you for listening. Thank you for following me, all who care and is concerned and who's interested. Thank you. Thank you to all you guys for following me. Continue to pray for me. I continue to pray for you guys. And see you on my next video. Thank you.